And so without further ado, I'm just going to turn it on over to him. Thank you so much, Mike.
Oh, thanks, Teresa. I really appreciate it. I'm really excited to do this. I've been actually involved with in and out of HIPAA for a number of years. Besides the dental industry, I've worked for a number of years in the medical industry with medical software. And so I've seen the HIPAA police float in and out for a number of years. In fact, I was thinking of calling this How to Avoid the HIPAA Police. But you helped me with a better title, Teresa, so thanks for that. I want to talk a little bit about kind of my background and how it relates. So I've been involved with technology. I'm somewhat of a geek for about 30 years, and I've been involved with both medical and dental software and associated issues around this for a number of years. Besides a lot of the education I do, I've also done a lot of consulting with practices on selection, contract negotiation, things like that. And in the part of my business that is contract negotiation, I've run across a lot related to HIPAA, so this is kind of near and dear to my heart. I was thinking originally of giving you a lot of the case studies on how people get sued, how they get fined, but I'm assuming that you've all seen that. That's probably one of the reasons you're here. But I ran across this slide, and it's really interesting when you look at this, that between 2009 and 2013, there were about 184,000 individuals that were related to breaches. The reason I bring this up is because that was ending in 2013. However, healthcare is changing dramatically, as you all know, and that kind of precipitated the reason for the new omnibus rule. And there are a number of reasons why I think HIPAA has changed a lot and why we really have more data. One of the things that's happened is the patient-centered medical home. Really, over the last couple of years, especially in healthcare, there's a lot of concepts that have led to much more data kind of floating around and being available. One is the concept of what's called a patient-centered medical home, which now all of a sudden you have a lot of teams, you have a lot of different providers that send data back and forth to each other. You have things called accountable care organizations that you're going to be hearing more of in dentistry, which is actually using outcomes. And to do outcomes, obviously, there has to be more data floating around. There's things called health information exchanges, which actually share patient information between entities, between states, between cities, between hospitals, practices. So this is happening more and more. Web portals, the ability for patients actually to go online and look at their data, that's available. And then, of course, we all know about what I call the explosion of mobile devices. Finally, you probably all heard about the EHR incentive program. By getting an electronic health record, the feds can give you certain money. And the reason I bring that up is because the feds and state governments particularly are interested in data. So what this all leads to is just much more data now and in the future being floating around. That's one of the reasons why we have expanded HIPAA legislation, because over the next 5 to 10 years, you're just going to see an explosion in patient data in all kinds of places. Oh, that worked. Okay, there we go. I learned something. Okay, so what are the changes here? What's actually happened with HIPAA? Okay, you've probably all seen and heard that this HIPAA legislation, which went into place in September, is just sweeping. It just changed everything dramatically. So how does this really change things? How is this different than what we're used to from HIPAA legislation in the past? Well, this is more of a 10,000-foot overview on HIPAA and some of the things that are really important. So I tried to outline some of the major areas that have really changed. And the biggest thing that you've probably heard about is obviously increased liability penalties. We can now have up to $1.5 million of penalties assessed to you. And these are all dependent on, there's a tiered structure, and I don't want to go into the detail of it, but that's a great change from what was there before. In terms of breaches and how you report on breaches, that's changed dramatically as well. In terms of business associates, it's changed a lot. And I'll talk about it a little bit later, but now business associates and their contractors, there are a lot more definitions. There's a lot more folks, basically, that need to sign these agreements. you probably heard that patients now have more of a right to receive electronic PHI. By PHI, I mean protected health information. So now it's leaning towards the patients being able to get their information and having a right to get their information electronically in a number of different ways. Also, the thing to remember is the limitations we have, the limitations on the ability to sell PHI and the limitations on the use of PHI for marketing purposes. This is also expanded. So basically, in a nutshell, there's three major things that are happening here. One is the penalties and liabilities have been increased dramatically. The patients now have much more rights in terms of how their data is used. And then there's a lot more limitations on how a practice or an entity can use the information. So it's really interesting because when we think about HIPAA, we think about what do we need to know ourselves as a practice. But really, to me, what's actually as or more important is to really understand all the folks you need to have questions of. And really, it begins with your own practice. You have to ask internal questions to your practice, to yourself, your staff, and I'll go over these in this talk. Also, when you think about it, now you have your dental software vendor. You need to ask questions, especially if you're choosing a vendor. Whether you have a vendor presently and you're interested in how they comply with HIPAA, or whether you're choosing a vendor. Also, the hosting model, cloud models, web models have become really important and really popular and will continue to grow. So it's really important that you understand the questions, the technical questions, to ask a cloud vendor or a hosting vendor. And finally, everybody has contractors and other folks that they work with. And so we really need to address the questions to those folks as well. But let's kind of start with what's really most important. And actually, when I went back and tried to put this thing together, I thought about what question I get most when I go into practices and I help them with software. And it's really this question of, okay, how do we communicate information? What does HIPAA mean to communications, both between our office and other offices, our office and patients, and our office and other entities? And the question surrounding this really is, what is protected health information? When we talk about communicating and sending information, what really constitutes the type of information that HIPAA says you really have to watch out for when you send? And really, this is just a subset. I mean, you could probably think of all kinds of things, but really the treatment plans, obviously images, and these take up a lot of space, by the way, when people try to send these emails. So I'll talk about technologies to do this, patient referrals, insurance information and payment information. Sometimes people don't think about that being PHI, but it is. And then, of course, the provider communications, prescription information, reminders, things like this just kind of give you a little subset, just to kind of have you think about the types of information you're sending out of the office and receiving from other offices. So here we have what people use a lot, email. Okay, if you notice here, they actually send attachments in email. This is very typical, right? They talk about patients in email. Realistically, though, this is not HIPAA compliant. Never has been. It isn't now. And so we really have to avoid that. Also, people think, well, maybe if I don't use email, I can use things like Dropbox, Google Drive, SkyDrive to send images. That's also not HIPAA compliant. For a few reasons. I mean, obviously, first of all, these companies aren't going to sign business associate agreements with you. And they also don't have the encryption. They don't have the technical security, typically, to be able to have protected health information. So what is compliant? How do we make something compliant? Here's just one example of how it works. So if you notice, the way you make it compliant are using what's called secure server technologies. So there are companies out there third parties and sometimes dental software vendors themselves that have the ability to have these secure servers. And the way it works is a patient, a specialist, another provider, whomever is in the loop here would get an email, basically, in this case, an Outlook email saying, okay, there's a message here. In this case of something on your tablet or mobile device, it says there's a message here. And what happens, the way this process works, is you click on the message, it takes you back to the server, to the secure server of where the data is. You log in, and then you have the ability to do whatever you want with it. Okay, quite a difference than sending emails through the internet. It can be hacked. It can be sent to wrong places. So now this is called what's secure email or secure mail. There's a number of different terms for it. So one example is there's a company called Brightsquid. There are a number of companies that do this, and this whole thing is growing dramatically with secure communications. But here's an example of a company called eDossier, who actually, once you check into the secure mail system, you have a screen like this, and it allows you to put attachments, like images. It allows you to communicate on like a sticky notepad. It also allows you, there's tooth charts, and you can enumerate the teeth that you're interested in. So this is one vendor's way of actually having it be secure. Once they send this, and by the way, if you take an example of, let's say, a general dentist using this system, and then they just want to send it one time to a periodontist, they basically have the periodontist email or Gmail account, and what happens is, if you look at the other end, let's say I'm the periodontist getting the message, I would just get a message like this saying, click on this link here, and again, it will take me back to that secured server. Okay, again, we're not doing email here. There's no protected health information, but we're going back to the server. Okay, so this is just one vendor's way of doing it. Now, when we think about this whole technology, it could potentially be a hassle, right? You're in your dental software, you're doing exams, you're doing imaging, and all of a sudden, boy, now you have to send a secure message. So you have to go into this vendor's secure mail, do that. Well, what's happening more and more, and actually I should say that this is very common in the medical world, in medical software, is that we're going to start seeing in dental software more integration of these applications. And this is really important because this is where everything's going. Instead of having different applications on your desk to go in and out of, in this case we have an example, eDossier has worked with Dentrix. And actually, can you see, Teresa, can you see the Dentrix? They have a little window that's kind of covering up. Can you see in the upper left side where it says Dentrix software? I need to close that. There you go. Okay. So in this case, you have Dentrix G5, but if you notice, there's an icon here. Okay, and this icon leads directly to the eDossier application. So in this case, you're getting secure mail through the Dentrix G5 application. There's also other ways of doing this. In this case, this is an endo practice. This is their website, and if I'm a general dentist, what I would do is I would click on a referral form, and then it would take me to a form which actually is custom-made. See all these questions down here? This is secure. This is secure communications. This, again, is going to the servers. Okay, so in this case, they went to a website, clicked on a link, got a form, and sent it. So these are some of the mechanisms of some of the technology that's starting to happen with integrating applications, and you're going to see more and more of this happening in the near future. Another question that was asked about me is collaboration. Collaboration, I talked a little bit earlier about the idea of what's called a patient-centered medical home. That's the idea of a dentist, general physician, cardiologist, periodontist, all collaborating on a case. So how do you do that? But how do you do it in a HIPAA-compliant way? And one way to do it is, here's an example of a company called Brightsquid. And what they've done is they've taken secure communications up in the cloud, and they've actually tied it in so now you can collaborate with a number of different providers. You can also do things like, again, in a HIPAA-compliant way, you can send images, or people can collaborate on images. You can annotate. You can annotate these images. Let me do this real quick. There you go. You can annotate the images. Here's another example of an annotation. And these are available basically to everybody that's a team member that collaborates in the cloud in a HIPAA-compliant way. So again, we're not using email for any of this. It's all on a secured server that we're sharing. Just like when we have social networks and we collaborate on projects in the cloud these days, the cloud is becoming very popular for this kind of thing. In fact, if you take it a step further, if you look at some more of these examples, also with the collaboration, it shows what steps they are in treatment, what's going on. Okay, and again, this is all in the HIPAA-compliant way because you're using a secured server. Okay, finally, there's also the ability, this also has the ability in a HIPAA-compliant way to send information to a dental lab. So in this case, the general dentist has sent in a HIPAA-compliant way using this technology. They send information to a dental lab, and actually it's reported on what step the production is. So internally, how are we trained on HIPAA requirements and compliance? It's really important. I mean, you read a lot, and you can go online, and you can look at white papers, but there are companies out here, and maybe you know some already, that have different kinds of training and education and certifications. So it's really important that an office manager and their staff get certified on whatever level they're comfortable with. There are different kinds of certifications. In this case, it's a professional certification. In this case, it's a certification for the staff. Okay, but the point is that it's really important to look to get trained and educated. And then finally, really you want to ask yourself the question if you really have any meetings to discuss HIPAA compliance. I mean, with everything going on in everybody's daily life, there's a lot of things that you just don't have time to do. But especially with the changes in the omnibus rule and HIPAA, it's extremely important to at least sit down and talk about it if you get trained to share the information between each other. So it's just like with everything else. When I help people do software, it's really important that we take the time to sit and talk about implementations and project plans. So I know everybody's busy, but it's just another thing that's really important to think about. These questions to technical partners, I believe, are really things that don't get asked about very often. And really, when you think about HIPAA, especially when you're going more and more to the cloud, or you're counting on your IT contractors to run your databases, it's really important to ask the right questions to vet these folks to make sure that they are going to be compliant with HIPAA. There's a lot of technology here. Really, when you look at the databases, the security, cloud systems, data centers, a lot of HIPAA is what I call under the covers, related to the technology itself. And you don't have to be a technologist to really ask the right questions. If you look at this, there's sections here in HIPAA, like identity authentication, user IDs, all these types of things that really relate directly to the technology. Things like implementing electronic procedures that terminate a session. Things like making sure the person is authenticated and identified. So I believe that especially when you're looking at new dental vendors, putting things in the cloud. I was working with a dentist the other day who actually had a Dentrix solution, and they were looking to put it in the cloud. So even though they had a present solution, they actually had to vet the vendors. We had to ask a lot of questions of that vendor to make sure that they were HIPAA compliant. So really what HIPAA boils down to is there's a lot more and more technical questions to be asked. And the first one, really, I guess as we move into a new world, is this. Okay, I actually heard a story from a dental practice about a dental software vendor that was actually a cloud vendor and moving to the cloud. And they actually told them that even though Windows is sunsetting XP, which means that they're not going to support it anymore after April 8th, that as long as the application was in the cloud, it was HIPAA compliant. And that totally was not true. I don't know if any of you had any experiences like this, but Windows XP with no support, software changes all the time, and especially with security. So even if you had a cloud vendor on one end managing your software, and you still had XP workstations, if there were any changes that were made to XP, or there were any needed changes, and you couldn't get those, you would be on the hook for a HIPAA violation, even though Microsoft is not supporting it anymore. So this is really important because we're all going to a new technology world, and one of the things to recognize is that by having Windows XP workstations, you're really not compliant anymore. Okay? When we talk about technical partner questions, okay, and again, going back, technical partners are your dental software vendors. They're any cloud vendors that you use. And these can be the same. A dental software vendor can have a cloud solution, or a dental software vendor can actually contract with a cloud or data center to put your software on. So those are two entities that I call technical partners. And then, of course, your typical IT contractors, the folks that come into your office and deal with your workstations or servers if you're not in the cloud, or your databases. These are the folks that you really need to ask some very, very, very targeted questions. And the first one, really the base of this is, are they willing to sign a business associate agreement? Okay, that's simple. And a business associate agreement, for those of you who don't know what it is, it's really a contract between you and a subcontractor that basically lays out the rules of the road about what your rights and their rights are and what the penalties are concerning HIPAA, breaches of HIPAA processes. So really it's a document outlining the relationship is regarding HIPAA in your patient information. So if somebody's not willing to sign a business associate agreement, I would probably first ask them why and then run. Because anybody that you touch business with really needs to sign these, especially when it comes to your data. When you're dealing with a data center, and again, more and more, you're starting to see dental software being run in the cloud, being run in data centers, being run in different states, different places. You really have to ask them, do they have what's called a HIPAA report on compliance, or an HROC? This means that the data center is kind of given the blessing that, yes, it's HIPAA compliant. Anybody with some money can start a data center, but not everybody is HIPAA compliant. This is really important to note. With cloud computing getting really popular, there's more and more and more folks out there trying to make a buck by opening data centers, saying, put your software on my data center and you'll be fine. Well, the first question to ask in addition to the business associate agreement is, do you have a compliance certificate? And that kind of covers you. That does a lot of your vetting, so you don't have to be a technical expert. Okay? How about training? You can have a data center, or you can have a dental software company. But is the staff trained on how to deal with it, and the rules and the regulations and the processes around it, and how when there's breaches, how to report? Okay, again, questions to ask when you're vetting is really surrounding this education and this training. HIPAA changes a lot. I mean, it had a dramatic change last September, but it will continue to change. It's a federal program, right? And as we get more data floating around, HIPAA will change. That's the one thing that's for sure, is you're going to see new regulations. So you can have a data center or a dental software vendor or an IT contractor that understands HIPAA now, but do they have a plan? I was talking to an IT contracting group about a week ago that I was working with, and they actually consistently have their folks that go to the offices trained on HIPAA to get certified time and time again when there's changes. Okay, so do your partners have that? How about policies and procedures regarding data breaches? This is something that's dramatically changed with the new omnibus rule, is what a breach is and how it's reported. Service level agreements are things that I don't think many offices think about. A lot of data centers, a lot of dental software companies say, I will do this, I will do this on a timely basis. Salespeople assure this type of support for you. But the question is there an agreement? I mean, a lot of my time is spent reviewing and structuring agreements with dental software vendors, with hosting companies, with business associate agreements. And I'll tell you that when you look at these agreements, and I bet if you look at your agreements, for the most part, you're not going to find a lot of these metrics in there. When things are supposed to be done, do people walk the walk and talk the talk? Okay, so it's important to have service level agreements. And in your regular contract, if you have a dental software contract, an electronic health record contract, a hosting contract, the question is HIPAA compliance in these contracts? I can tell you that sometimes when I negotiate some of these contracts, what I'll see, for example, is that we're HIPAA compliant, okay? But there's nothing about that they'll stay HIPAA compliant. There's nothing about what the HIPAA compliance is. So be aware when you or your attorneys or somebody else looks at your contracts, especially when you're looking at new contracts, make sure that some of these things we're talking about today are in there, okay? So really, these are what I call more of the administrative kinds of questions that you might ask of either a new vendor or your present vendor. One of the areas, though, as you get a little bit more technical, that gets really important to think about is really the data itself. Okay, that's really what HIPAA is about, right? It's about your patient data. And so really the questions to ask, and you don't have to be a technical expert, are surrounding the storage of it, the management of your data, and how about the disposal of your data? So one of the first questions to ask, and this is really an interesting one, is let's say you're dealing with a cloud company. Cloud company can be anywhere. Your hosting center can be in Texas, it can be in Montreal, it can be in India. Okay, so one of the questions to ask is, do you store the data outside of the United States? Okay, now, I will tell you that data centers, good data centers, have different locations for backup. Okay, so one center might be in New York, and they might have a backup in London and a backup in Buenos Aires. The reason why I want to ask these questions is not that it's illegal or not necessarily HIPAA compliant to have the data outside of the United States, but what if there is a breach? What if there's a problem? What if the data center isn't following HIPAA regulations? If it's in a different country, there might be an issue in legally trying to get to that data center. So the reason why this is an important question to ask, and then you'll have to make the decision, is if the data center does store the information outside of the United States, if there is a problem, where's the liability? Okay, and are there any remedies if it's in a different country? HIPAA details a lot about backup and recovery. Obviously, it seems like it's common sense. And every data center will tell you that they do backup and recovery. But I will tell you, in over a decade of working with data centers, working with software vendors, having dealt with backups, having done a lot of agreements, I'll tell you that if you look at a lot of these agreements, they don't detail how it's done. So basically, they give you an assurance that we do backups. But really, you want to detail. You want to see what it's all about. You want to get detail on the backup. You want to understand if they continually test their backup and recovery processes. I actually had a practice that came to me about a year and a half, 2 years ago, that was with a hosting cloud-based solution. And there was an issue. There was a problem at the data center. and they had not made backups, or they might have made backups, but they weren't working for a week. So they had to manually enter a week's worth of patient data because that data center had not tested their backups. Okay, these things can happen. These are questions to ask, and by the way, these are things that you put in your contract. Okay, in terms of backup sites, you want to understand where they are. Do they have backup sites? Really? I mean, it sounds kind of silly maybe, but there's potential for a data center, somebody holding your data, to do backups and then put it in safe on their premises, right? So you want to understand, again, from a HIPAA compliance standpoint, HIPAA wants to know that there are places of backup, there are different places of backup. Now I get a little bit geeky on you with this concept called redundancy, mirror data, failover. What's all this technical stuff? What this technical stuff is that a good data center that is HIPAA compliant will have the ability to have the data stored real time in other places, okay? So in other words, the data center might have 3 or 4 or 5 locations, and that data, that same data, is stored in other locations. So you want to understand if they have this. And then finally, you want to understand what the procedure is to permanently delete their data. Because at the end of the day, let's say, for example, that you decide to leave that data center, leave that software vendor. They shouldn't be holding your data anymore. But really, do they have processes and procedures that really assure you that that data will be deleted? So really, all this is around data itself, your patient data from a technical aspect. That's why these questions are so important to ask. One of the things, I think we're getting towards it, in the medical world, auditing and logging information changes that happen to your patient data. Somebody makes a change, very common. In the dental world, not necessarily as much, even though you're still on the hook for HIPAA for the auditing requirements. That's why I want you to ask these questions. Because in the dental world of software, of dental software hosting, it's not quite as common. So some of the questions to ask, really, of either your dental software vendor, your cloud hosting vendor, does the system have the ability to audit changes to data? Okay, you cannot just take a patient's record and just make a change to it without that being recorded. You cannot delete it without being recorded. Okay, it's a requirement to be audited. In fact, sometimes people argue, to go back to what I was talking about before about email, some people say, well, you know what, encrypted email is okay. If I can send email and it's encrypted, that's just fine. Okay, but there are also auditing requirements, okay, to communications. So the idea about auditing is extremely important. Okay, along with recording data and changes to the data, you can't just get rid of your data. You can't just delete it, okay, ad hoc. So there have to be mechanisms to prevent this. Also, there has to be mechanisms that say that an authorized person, if in fact the data is changed, destroyed, done, it has to be authorized. And what's very, very important is these auditing mechanisms have to show who accessed, changed, destroyed the data. We don't see this enough. Okay, it's easy. I can tell you, having done software for years myself, in software development, I can tell you that really it's not that difficult to allow somebody to make a change or delete the software. A little bit more difficult to record who did it, what was done, the changes that were made. And this is really important, not just for HIPAA, because we need it for HIPAA, but in any practice audits on the data. Okay, these are going to come up at some point. How about technical questions related to just the privacy and the security of the data? Is there technical ability, as we talked about before, to guard against unauthorized access. Passwords, key fobs, all kinds of technology that allow you to get into the data. Are there measures to guard against this? But also when you talk about a data center, so if your information is in the data center, what are the physical security measures? There are various levels of security for data centers. And they're really dependent on how easy it is to get in to a person's server. Sometimes servers are in cages. Sometimes they're out on the open floor. There's different levels of security. So we really want to understand what level of security, when you look at that data center your data is being put into, or you talk to your software vendor that actually has a data center, understand what is the security behind it, both from a technical standpoint and from a security standpoint. Okay, actually one of the most important things here is really the automatic termination of electronic patient session. I was talking to actually an IT contractor. It was very interesting, but he and his daughter were actually in a practice, and the provider left the room and all the information was left on the computer. It didn't time out, it wasn't turned off, and so from a HIPAA compliance standpoint, that needs to be changed, and actually went and told the practice about it. But more times than not, you don't have the technology to automatically terminate. This is really important from a HIPAA standpoint. And the data breaches have been changed in terms of HIPAA regulations. The new omnibus rule really addresses data breaches and how they've been changed. So it's really important to make sure that your center, wherever your data is being stored, that there are policies and procedures for this. And from a technical standpoint, when you have servers that host your information, you need to separate it. Okay, it's much easier to get in and hack information if everything's on one type of server. So some of the questions to ask your data center are if they keep your information, your database servers, which holds your patient information, separate from other servers, servers that hold the application, servers that do other things. So we really want to have, for security and for HIPAA compliance, we really want to have separate database servers. One of the things that's actually changed a lot with the new HIPAA regulations under the omnibus rule is what is a business associate? Okay, it talks about you as a covered entity and what you have to do and your requirements. But really what's changed a lot is that a business associate is now people that touch your data in a lot of different ways. It can be people that do claims processing. It can be people that do data analysis, utilization review, any kind of quality insurance, benefit management. It can be healthcare organizations. E-prescribing is getting a lot more popular. Okay, so really, when you talk about business associate agreements and who you have to give them to, I would say it's more safe to give them to people you're not sure of. Okay, if you're not sure if somebody's a business associate, really just give them a business associate agreement to sign, because the definition has really expanded. Okay, in fact, the liability of business associates have expanded as well. Okay, business associates are as responsible as you are under HIPAA to keep your data secure. So therefore, if you have a data center, it's really interesting, but even in a data center, even if they don't have people that are working on your patient information, if they aren't HIPAA compliant, they still will be liable under HIPAA. So it isn't necessarily people that touch your protected health information, but that people that have the ability to do that. So this is really important here, down the chain of information flow here. So it really starts with you as a covered entity. It covers direct people you do business with and their subcontractors. And as business associate agreements have changed, you really need to change that. In fact, if you have a business associate agreement with a present vendor or with a present subcontractor, you have a year, well, basically at a year from September 22nd when this was enforced, but you have until September 22nd, 2014 to basically change your business associate agreement and modify it under the new HIPAA rules. Obviously, if you have a new business associate and it's a new contract and a new business associate agreement, then you have to take care of it now. But you have until September 22nd on previous business associate agreements. So that's a really important date because then you're out of compliance if your agreement is not modified or changed with the new rules by that time. In all the years I've been dealing with software and with these agreements, there's so many times that, especially when you're purchasing new software or purchasing some kind of services or hosting services, that the people talking to you give you assurances that it'll be HIPAA compliant, especially with the new rules, it'll be this and that. But just as with everything else, it's really important to get that down in writing. Okay, everything we're talking about here today, these kinds of questions, if you ask folks these questions and you get answers, get these in writing. Get in writing about your backup. Get in writing that they have policies and procedures. Get in writing that they have been verified and they comply to HIPAA. Get all this stuff in contracts. Because really, at the end of the day, I think you all know this. I mean, you've run practices and you've seen this time and time again. And with HIPAA and with the increased liabilities, the increased penalties, it becomes more important. So who's on the hook? Okay, and I guess the bottom line is that really, when you look at business associate agreements, when you look at HIPAA sections in your dental software and hosting agreements, it's really important, even if a vendor says they don't want to do it, really push for it, because at the end of the day, the rules of the road for HIPAA and HIPAA Omnibus can be put into your agreements. So it's just really important you do that. So I guess, Teresa, I'll kind of turn it over to you at this point and see if there's any questions.